really, there's a lot more to healthcare facilities, as I'm sure a lot of you know, about what documents actually apply or the applicable documents. So I always like to remind everybody that Article 517 is a piece of the puzzle. A lot of this, if you've been involved deeply in Article 517 or healthcare facility applications over the last 10 years, you know that there's been a strong influence, which there always was, but even more so from the Healthcare Facilities Code, NFPA 99. So that always is a large part of it. A lot of what's in Article 517 today is extracted from NFPA 99. And of course, NFPA 101, the Life Safety Code, and NFPA 110, which is the standard for emergency and standby power systems, which essentially covers the power supply system right up to the transfer equipment for level 1 and level 2 systems. So one of the unique things about the National Electrical Code is it's a standalone document, and it doesn't bring in other documents by reference. If you adopt NFPA 99 or the jurisdiction that you're in adopts NFPA 99, a lot of times you'll get NFPA 110 and other documents incorporated by reference. And it's the same thing when you adopt the Life Safety Code, you get NFPA 110, and a lot of building codes will do the same thing and reference other documents. The NEC is very unique in that respect, that it's a standalone document and it doesn't incorporate others, only in informational notes to let users know or readers of the document know that there's other codes and standards that could apply. But so these are some of the other documents that we discuss in a longer day. So this program was updated to the 2020 NEC. I realize that a lot of places in the country are still on the 2017 and even the 2014. I live in the state of New Hampshire, and we're still on the 2017 NEC. And you'll see some 2020 flags like you see up in the right-hand corner of this screen, and I'll talk a little bit about what those are. It's not intended to be a changes program, but only to identify that there may have been a little bit of change. And in this case, it was only a change in the wording. I wouldn't say there was any technical change. It applies to the construction and installation criteria, which is really the new language. It always applied to healthcare facilities. A few cycles ago, we added the language that it only applied to human beings. When I worked for the state of New Hampshire as an electrical inspector, there were many times that I fielded questions related to something that you'd see on the right side of the screen, where it's it's still considered a hospital and an animal hospital. It's not, Article 517 doesn't apply, although there's a lot, they have operating areas and similar things. And I'd like to try to everyone to convince my wife that it shouldn't rise to that same level for our pets, but nevertheless, Article 517 doesn't apply to those types of facilities. So this is an overview of the layout of Article 517. And I'm going to try to give as much information as I can today, and kind of hopefully it'll entice some folks to want more of the program that really lies behind some of these slides. But this is a general layout of how Article 517 is. And I think that's an important component of today's program, is to provide a better understanding of how 517 is laid out and how that applies. So we're going to touch on a lot of this. We're not going to cover parts 5, 4, 5, 6, and 7, and down into those parts from anesthetizing locations down. We won't get into that today. We certainly wouldn't have enough time to do that. My goal is to talk about some of the general requirements, what the different types of healthcare facilities are, and perhaps how those main portions, parts 1, 2, and 3, apply to those different types of facilities and what those different types of facilities are. And that's especially true when you get into the essential electrical system, which is really part 3 of Article 517, and how that applies to the different types of healthcare facilities.